Okay, let's talk about navigating the healthcare system. It can feel a bit like finding your way through a maze, right?
Oh, absolutely.
Especially when you're trying to figure out, how to get the best care or even just understand what's going on.
Yeah, what actually goes into making sure the care you receive is high quality
Hmm.
and safe and, well, effective.
It's definitely not simple. It involves big systems, dedicated professionals, and honestly, your own role in the whole thing.
Exactly. Quality and safety, they're kind of built from the ground up, but they're also guided from the top down.
And that's precisely what we're diving into today. We've got a stack of sources here, everything from global accreditation groups to practical advice for patients, and we're going to unpack them.
Right.
Our mission really is to understand the different layers, the different facets of healthcare quality and safety, and figure out how you can be a more informed participant in your own care.
We'll look at the organizations setting the standards, the teams actually delivering the care bedside, and, crucially, the part you play in navigating it all. It's about seeing that whole picture.
What actually goes into patient well-being?
Exactly.
Okay, so let's start with that big picture view from these sources. How are those basic standards for quality and safety actually set up in healthcare?
Well, quality healthcare doesn't just happen by accident. It takes deliberate effort, systems, measurement.
Right.
And a huge part of this comes down to external accreditation bodies. They provide a sort of framework and evaluation process that hospitals and clinics use to make sure they're meeting recognized benchmarks.
Okay, so like the ones mentioned in the sources, Joint Commission International, JCI, or maybe the National Accreditation Board for Hospitals and Healthcare Providers, NABH.
Exactly those. JCI is presented as a really big player globally. Their mission statement is pretty bold, actually, to enable and affirm the highest standards of healthcare quality and patient safety for all. And their vision is focused on zero harm and highly reliable care delivery.
Zero harm, that's quite a goal. And their reach sounds huge, operating in over 70 countries, accredited more than 1,000 programs.
Yeah, supported by over 600 experts around the world. They're definitely trying to influence standards on a massive scale.
So how do they do it? What does accreditation actually involve?
Well, it involves these rigorous international standards. They mentioned the international patient safety goals, for example,
Hmm.
and a really detailed evaluation process. It's designed to help organizations measure, assess, and improve performance.
So like a blueprint.
Kind of. Think of their published standards, like the JCI standards for hospitals, 8th edition, as the operational guide for hospitals trying to achieve that top-tier quality.
And the sources mention how going through this accreditation actually changes the hospitals themselves, like testimonials calling it a best team building exercise.
Right. Improving teamwork, unity, enhancing overall coordination and communication skills.
Mm.
It's not just about getting a certificate. It seems to be about transforming how they work internally. The benefits listed include things like gaining a competitive advantage, building community confidence, better risk management, and critically, helping hospitals organize and strengthen patient safety efforts.
So it pushes them to really build a culture of patient safety.
Exactly, forcing them to create robust, patient-focused systems.
And then there was NABH mentioned, especially for India, similar idea.
Yeah, very similar function. It's a constituent board of Quality Council of India, and it's focused specifically on setting up and running accreditation for healthcare organizations within India. They aim to set benchmarks for progress and build an ecosystem for quality there.
Okay, so both JCI and NABH are pushing healthcare organizations towards continuous improvement using established standards.
They provide that external validation, that push, and importantly for the listener, they give you a way to know which places are actively trying to go above and beyond the minimum requirements.
Which brings us right to the key question for you listening. Why does this hospital accreditation stuff actually matter to you when you need care?
Well, because these standards and the whole demanding process of achieving them are fundamentally designed to protect you, the patient.
Okay.
When a hospital gets accredited by someone like JCI or NABH, it's a signal. It means they've put systems in place for everything from, say, infection control and handling medication safely to being ready for emergencies and making sure staff are competent.
So it's like an assurance.
It's an attempt at assurance, yeah. A way of trying to ensure a safer, more reliable experience for you when you walk in. It means the system is actively trying to reduce the chance of errors and harm.
Okay, so that's the high-level view, the standards, the organizations.
Yeah.
But healthcare isn't just about certificates, right? It's about people interacting, coordinating care right there at the bedside.
Exactly. That's where collaboration comes in. It's absolutely essential.
The standards set the stage, but the quality happens through teamwork.
Right. The sources really hammer this point home. Navigating healthcare, especially if it's something complex, is tough. And a collaborative approach involving patients, their families, and healthcare professionals can improve outcomes.
Yeah, one source put it really nicely. Good healthcare is not one-sided, it's a partnership. And that collaboration in healthcare isn't a luxury, it's essential.
It's not just nice to have, it's fundamental.
So who are the key players in this partnership, according to the sources?
Well, first and foremost, the patient.
Yeah.
You're the center of the healthcare journey. It's your health, your experience.
Short six.
Then you have family and caregivers. Often they act as advocates, emotional anchors, decision-making support, really crucial roles.
Absolutely. And then the medical team.
Of course, doctors and nurses providing the medical expertise, guiding diagnosis, treatment, and care.
Yeah.
But the team is broader now.
Ah.
The sources rightly point out support staff people and labs, admin behind the scenes, and other critical professionals like pharmacists, dietitians, physiotherapists. It takes a village, basically, a multidisciplinary effort.
So when all these different people actually manage to work together, what are the real benefits for the patient, for the system?
For you, the patient, the sources talk about improved patient outcomes. Things like better management of chronic conditions, fewer complications down the line,
Okay.
and also enhanced patient satisfaction. Just feeling heard, understood, respected, feeling like part of the team, not just a diagnosis.
Yeah, feeling respected makes a huge difference. It sounds like that partnership can also cut down on the stress and anxiety that often comes with being sick.
Totally. And when there's open communication among everyone involved, including you, it leads to better diagnosis and more efficient treatment because everyone has a clearer picture.
Fewer misunderstandings.
Exactly. Which critically helps reduce errors. And of course, having that trust, that partnership, provides vital emotional support.
And for the healthcare system itself, it sounds like collaboration isn't just better care, it might be more efficient too.
That's the idea, leading to increased efficiency and cost savings by, say, reducing unnecessary tests or procedures, just improving overall coordination.
Makes sense.
And the sources even mention specific models built around this, like team-based care or integrated care, where maybe mental health services are brought right into primary care settings.
So bringing different types of care together more smoothly.
Yeah, recognizing that health is complex and needs a unified approach, not just isolated specialists.
Okay, so we have standards setting the stage, collaboration bringing it to life, which leads us to maybe the most practical part for you listening. How do you navigate this complex system effectively? What's your role?
Yeah, this is where some sources, like the one titled, "Don't Expect One Doctor to Solve Everything," give really direct advice.
Right.
It tackles a common issue head-on, why relying on just one doctor isn't always enough in modern medicine. The key idea, specialization, is key. Your general practitioner, your GP, is invaluable for overall health, absolutely. But the depth of medical knowledge today means no single person can be an expert in everything. Complex cancers, rare diseases. Specialists spend their entire careers mastering one specific area.
So it's not saying your GP isn't good, it's just that the field itself is too vast.
Precisely. And that leads directly to why referrals and multiple opinions are so important. The source points out the limitations of just sticking with one perspective, especially for tricky issues. Asking for a second opinion or referral to a specialist isn't about distrusting your doctor. It's about using the system effectively to get a fuller picture.
That's a really helpful way to think about it. It makes asking for a referral feel less like being difficult and more like being informed.
Exactly. And for really complex medical situations, the source highlights multidisciplinary care. This isn't just seeing a few separate doctors, it's about a team of specialists.
Like for cancer care.
Right. Maybe an oncologist, a radiologist, a surgeon, plus maybe a dietitian, a physiotherapist, all working together, discussing your case.
Yeah.
Expecting one doctor to manage all that, it's just unrealistic and limits your access to the expertise you need. You need the whole team.
The source also had some really practical tips for just managing appointments, like not trying to cram too many different things into one visit.
Yes. Don't bring up multiple unrelated issues in one appointment with the same doctor. If you go in with, say, A rash, a headache, and a question about cholesterol, the doctor only has so much time.
Right.
Trying to cover everything might mean nothing gets the focus it needs. The advice is plan separate visits for different concerns. It lets everyone give each issue proper attention.
That makes a lot of sense. And it also touches on why you shouldn't expect only doctors to handle everything. That point about overlooking the role of non-physician healthcare providers.
Super important. Nurses, physiotherapists, dietitians, mental health professionals, these are your allied health professionals. They offer crucial expertise for well-rounded care, prevention, rehab, managing chronic stuff. Your team should absolutely include them when relevant.
Another big point was shifting from just reacting when you're sick to being proactive.
Yes, overlooking the need for preventive care is a major pitfall mentioned. Don't just show up when something's wrong.
Do the checkups.
Exactly. Take a proactive approach. Regular checkups, the recommended screenings, vaccinations. That's fundamental for catching things early and staying healthy long term. Your primary care doctor is key here, but so are those allied health pros helping with lifestyle.
And finally, managing expectations. Especially with complex conditions, things might not get fixed overnight.
Right. The source warns against expecting quick fixes for complex conditions. Healing, managing chronic illness, it often takes time. Different approaches, that ongoing collaboration we talked about.
So patience is key.
Patience and being collaborative with your team. Understanding it's a process, not just a quick fix. That's really important for getting through it successfully.
These points really drive home that being an informed patient isn't about knowing all the medicine yourself.
No.
It's about understanding the system, the team, and your role in making it work effectively for you.
It's about being an active manager, really, of your own health journey within that whole complex setup.
Okay, so we've hit standards, collaboration, your personal navigation. What about the stuff happening behind the scenes, the support that helps hospitals actually do all this complex stuff?
Ah, yeah. That's where you see services that specialize in helping healthcare organizations implement these things. The sources briefly mentioned companies like Suprematic Consultancy Private Limited. They work with hospitals on those foundational pieces needed for quality.
So they help hospitals get ready, essentially, build the capability.
Precisely. They might help a hospital with, say, planning the physical layout for efficiency and safety, or implementing the kind of quality management systems needed for NABH or JCI accreditation,
Okay.
or maybe setting up operational processes like systems for handling patient info smoothly, or coordinating workflows in places like operating rooms, all the stuff that's essential for safe, coordinated care.
So they provide the expertise, the support to help hospitals build the actual infrastructure and processes needed to meet those high standards we talked about earlier.
Exactly. They're part of that wider ecosystem that helps healthcare institutions achieve and maintain quality, which ultimately supports better care for you.
Okay, this has been a really interesting deep dive, kind of moving from those global standards right down to your personal interactions. Let's try and pull together the main takeaways from these sources.
Okay. First, I'd say quality healthcare isn't just random chance. It's actively driven by rigorous standards and evaluation set by bodies like JCI and NABH. They provide the benchmarks, the foundation for safety and quality.
Right. And second, delivering that care effectively really hinges on collaboration. It's a partnership, patients, families, and a whole diverse team of professionals, not just doctors and nurses. That teamwork boosts outcomes, satisfaction, and cuts down on errors.
And third, and maybe most importantly for our listeners, you are not just passive. To navigate today's specialized and complex system well, you need to understand when different experts are needed. Be proactive about asking for referrals, prepare for your appointments, and really participate in your own care and preventive health.
You have to be an active player.
Absolutely.
So considering everything we've discussed, the increasing specialization, the need for these multidisciplinary teams, the real emphasis these sources put on collaboration and your involvement. Here's something to think about. Does your active participation, your ability to understand who's on your team and how you navigate the system, does that maybe become the single most powerful factor in getting the best possible care going forward?
That's a great question to ponder. Think about the next time you interact with healthcare. How can you shift your mindset, even slightly, from just being a patient receiving care to being a partner collaborating with your team?
Reflecting on that could be pretty impactful.
Yeah, it really could be.